had also talked about beforehand was not only these combined movements, but I also made a case that, if we consider our options, one of those options was spinal, and we didn't fully exhaust the spine. You did retraction, you did thoracic extension, but we didn't really do retraction with extension of the cervical spine, nor did we do anything lateral. So before we go down the rabbit hole too deeply with every combined movement possible, let's also make sure that we've fully exhausted the spine. So that's what he does next, and does repeated thoracic extension with clinician overpressure. That gives no effect. Then goes lateral, does left lateral flexion. This was her left MCP, so he does left lateral flexion with overpressure, and then moved on to clinician overpressure. No effect. Then does MOBs, and at this point, actually, at this point I took over and was like, I really want to check your spine here. So I'm with the patient. I move into mobilizations. No effect. But I still wasn't satisfied. I was still suspicious of the spine. So then I have her lie down prone, and I do thoracic unilateral rotation and extension mobilizations. Right? So people can visualize that. We have this mobilization both for the lumbar and for the thoracic spine. You're just pushing unilaterally into rotation. It's called rotation in extension because lying prone is a position of slight extension to begin with. Mm-hmm. So I do that with the rotation being to the left. And it's clear, there's clearly more stiffness there than on the right side. And wouldn't you know it, it's clearly better afterwards. Mm. So I'm very excited. I've got 2 diploma candidates with me. They're like, the jaws dropping, like, oh my goodness, what? Because, doing this kind of unusual, we don't use unilateral rotation and extension mobilization. That's not one of those, like, every day I'm using it every day. No, like this is a once every 3 months, maybe. Like, I don't know. It depends what kind of clientele you're seeing, but you don't use it all the time. So to see that cause change when nothing else had caused change so far, they were in disbelief. Just like this was completely new to them. Firstly, because it was thoracic, but secondly, because it was lateral. But those 2 things just blew their minds.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.